Help us understand better what you might call some best practices. You worked hard to develop those relationships with the governors that you served under, with their chiefs of staff, with those people in just the governor's office now. What could you suggest worked for you perhaps? What could you suggest might be helpful to other people that want to strengthen their relationship with the governor's office in this job that you have?
Over the course of my tenure, both before being state health commissioner and after, I worked with 4 governors, 2 of them Democrat, 2 of them Republican. They were quite different leaders. So one thing I learned was you need to understand who's sitting in that office and what their priorities are and what their work style is. And you need to accommodate that. So I do appreciate that the governor is the one in charge, and our role needs to be assisting the governor in making the right decisions. Being flexible, that is an important part of the job. I've worked for governors, for example, some of whom who were micromanagers and others of whom who were libertarian. They felt like they didn't want to get in the details. They wanted you to figure things out. They just wanted there to be no negative stories. And it was important to adapt accordingly. So that was very important. I'd say another lesson I learned was patience with transition. We went through many different newly hired people in the governor's office, not the governors, but their staff. It seemed to us every 6 months there was some new, really young, inexperienced person who would be hired in the governor's office, whoever the governor was, that would call us up with a bunch of ideas and misunderstandings about what we did. And, when that's happened several times, you begin to feel like, do I have to explain this all over again to another new person who's just entered government? And what I've learned was you do. You need to be really patient, and you need to take that relationship quite seriously and not express any frustration, but be well prepared to do a thorough briefing and accommodate the needs of the governor's staff.
One other thing you mentioned different from the governor's staff and the governor's office is working with the legislature. That's a whole different world.
Yes.
Say a little bit about your experiences there, because again, some state health officials have never worked with people who were in elected positions, either in the state in state government.
Yeah.
What was that like? That's different.
I enjoyed working with the state legislature. The starting point, though, I would say, was that when I worked for different governors, they had different approaches to what a department head should be doing in terms of relations with the legislature. Some of the governors encouraged me to reach out to individual legislators and develop relationships and talk about my programs. I worked for a couple of governors who wanted legislative relations to be handled exclusively by the governor's office. So it was different under different circumstances. But I enjoyed working with the legislators. I enjoyed getting to know their staff. Their staff were often the key people that we needed to get to know. We paid a lot of attention to being responsive if we got a call from a legislator, if they wanted an answer. Once we got clearance from the governor's office, we tried to be incredibly helpful to them. We tried to answer quickly and accurately. We followed up with them. We wanted them to believe that we understood that we, in some sense, worked for them, and that we were well-trained, smart, and responsible.
Let's go back to one relationship issue that I think new state health officials sometimes need to learn more about. You work very actively with elected officials in the state General Assembly. Mm-hmm. Obviously, there's a governor's office. We'll talk about that in a moment. Mm-hmm. But could you say a little bit more about relationship building with people in the General Assembly who were elected officials around public health issues. What did you actually do? How did that go? You told me a story one time about the state lab and trying to you were all driving off on a trip somewhere and you were working with some of these people. But that part of working with elected officials is not something that a lot of people, I think, who become state health officials know about. Tell us about how that worked for you. What were some of the things you did that seemed to work?
Well, in my work with elected officials, I always was grateful for their service, that they stood for election, they made enormous sacrifices to be there with family and with their other careers. So the fact that they stood for election was impressive to me. When in working with them, so I was very respectful of them. I was also very, and still am, respectful of their role and what my role is. And I was pretty clear about understanding that my role was to bring the science on an issue, and based on that science, what my recommendation as a scientist would be, state health official, but recognizing that they have a different job and they have a different set of factors that they are using to make their decision, whether it's their constituent base or the economics of a situation. They have other responsibilities. So I'm there to give them my best guidance based on science. When you get off of your science, it's just a greasy slide downwards. So that's really important to stay there on your facts. And moving into advocacy is tricky. There are others that can do that for you. So working in partnership with others that are going in another way and another approach to do your advocacy work. Usually that's going to be, in my state, the local health departments were independent. So they could do that back home when they're seeing their constituents in the community or even in the legislature. And then the nonprofit sector is a very good partner in that way as well. The other thing is I always took someone with me. So you always had someone that made sure that everything was what you heard when you leave is what you thought you heard, that you're not getting pushed into a deal. You never want to make a deal with a legislator, So that third person and someone from your team helps everybody stay on the path you meant to stay on when you went in there. So there's just little tricks like that.
That's an extra pair of ears there. There's somebody else in the room with you that's listening at the same time.
Yeah, and shoring you up.
Yeah.
And it's not just about you.
Uh-huh.
It's your team, your system. I mean, you may take a local health director. When we worked on tobacco issues, we would go in when we were working on particularly the smoke-free bars and restaurants. Our most important partner when we would go in to see legislators was the head of the Restaurant Association. And it was interesting because the legislators, we've been working on tobacco 30 years, right, or more, they knew what I was going to say and what I thought, but they in that private office wanted to hear what that business guy had to say that was the leader of the restaurants. So we were there and we were there together, which was really important. Or we had a piece of legislation about where a legislator was really wanting to reintroduce unpasteurized milk to the food supply. So you go with your agriculture commissioner, and that's very powerful too. So you're careful about not only taking someone, but who you take is important also.
Yeah, pick it.